Hey, Dave here with Align Therapy. I'm here with Brad. He has volunteered to let me wax his legs. Well, one of them, I guess. I wanted to demonstrate how to do a taping for patellofemoral pain. Patellofemoral pain is pain underneath the kneecap. So it's a very probably the most common knee pain. Wouldn't you say, Brad? Yeah. Most common knee pain we see in the clinic. And it is pain underneath the kneecap where the kneecap sits on the femur. And it happens because there's inflammation between those, because usually the kneecap is tracking in the wrong way. We're not going to go in depth in why the kneecap is tracking wrong or what we do about that, because this is just about taping, but check out our other videos for that. Or better yet, come into the clinic and Brad will help you figure that part out. So we're going to use some KT tape for this, and I'm going to show you a simple way, and then we're going to rip the tape off and see if Brad screams or not. And so I'm going to use pre-cut strips of KT tape, and I'm going to take one of those and cut it down the middle about halfway. So one key thing with KT tape is you don't want to touch the adhesive on the tape. So you always tear the backing, and then you can hold on to the backing instead of holding on to the adhesive. So bend your knee there, Brad, a little bit, a little more, right there. Okay, so I'm going to take this strip, the piece that I didn't cut, and I'm going to put that just below his patella. So there's the bottom of his kneecap. I'm going to put that so that that split in the tape goes right below the kneecap. So then I'm going to take one of these little, I call them pigtails, these little pigtail strips, and I'm going to go around the patella to add a little bit of support around the patella. So we're going to do that same thing on the other side. Brad is a little hairy, so
it's going to feel good.
It's going to feel great. But if he was, if he was a patient, I would probably have him shave his legs, or at least trim it a little bit. So with this one, I folded the KT tape in half, and then I'm just cutting a little piece off of the end, rounding the corners, which gives us two pieces with rounded corners. And one way to tape the kneecap with this is you tear this in the middle, and we're not touching the adhesive. We're going like this so that I can put tension on that strip, and we're going to go right below the kneecap. We're going to tense it, push up into the kneecap, and then I'm going to have Brad straighten his knee. Go ahead and straighten your knee, and then we'll lay that down. One thing that's fun is in some people we get a little wrinkly kneecap here, but that's okay. That means that we're putting tension around the kneecap. This is for a little more general, where I'm pushing up into the kneecap and then I'm having him straighten his legs so that these side strips aren't too tight, so that this one stays on. But I want the tension around the patellar tendon right here. So has a little nice wrinkly kneecap. I'm going to have Brad pull this off. I'm not going to pull this off. So here we go. The longer the tape stays on, actually, the worse it is. So this shouldn't be too bad with Brad. If you've ever played the game Odds or Evens.
Yeah, I'm getting a lot of both probably.
Odds or Evens, you see how many hairs you get, and if you guess odds or evens when you count, then you win. So that's one way to do it. I want to show you a simpler way. If the kneecap is tracking too much to the outside, a lot of times some people use a taping called McConnell taping, which is using Leukotape and cover roll and trying to alter the mechanics of the kneecap with different tensions. I really like using KT tape, and I've switched to using KT tape almost all the time with trying to control the kneecap. Only in stubborn cases will I use the Leukotape because it's more aggressive. KT tape lasts a little bit longer too. But if we want the kneecap to glide more medially or to the inside because it's pulling too much to the outside, what I'll do is I'll take just a half strip, and this is a simple way. If this helps, it's easy to do on yourself. And you find the kneecap. So Brad's kneecap is right there, and this tape is going to go on the bottom 3/4 of the kneecap. So we're right there. When I move my fingers, I can see a little white spot until the capillaries refill, so you can kind of get a gauge of where that is. Then I'm going to take the tape and I'm going to anchor it on the outside of the knee, but I'm not going way far down towards the back side of the knee. And I'm going to push the kneecap in. This doesn't stick very well with all this hair.
A lot of hair.
So I'm going to medially glide the kneecap as I lay the tape down. And I don't want any tension on the ends of the tape. The last inch here and the last inch on the inside, I don't want any tension. So I'm coming back kind of close to where the hamstrings come, but I want to catch that kneecap underneath the tape. I put it on the lower part of the kneecap because as you bend your knee, your kneecap migrates down. And this can be helpful, just a simple quick taping. If you're having knee pain with running or something, and you're about to go out for a run, it's an easy one just to slap a piece of tape on there. I will have people bend their knee, so bend your knee a little bit, Brad, and just make sure that everything's staying. You might feel a little bit of hair pull on that.
Good amount, too.
A good amount.
Good amount.
And that will loosen up as you move it more. Some of those hairs pull out, some of them just loosen up. But this is a really easy one to do on yourself. Remember, we're not putting tension on the ends of the tape. We're going on the bottom 3/4 of the kneecap, angling up just a little bit, anchoring on the inside, and putting about 60 to 75% tension on this. You can play around with the tension and see what feels the most comfortable, but that's a really simple way to tape for patellofemoral pain. The other way, where I split the tape and went around the kneecap, I usually find that works better, but it's also a little more work to do. So hopefully this was helpful. If you're having knee pain and you have more questions, put those in the comments. We'd love to see you subscribe to our channel and see other things. If you're having knee pain and you want more advice, more guidance on what to do, come on in and see Brad. He'll help you out. Thanks for watching.